I'm David Googe. I am an orthopedic surgeon here at Orthopedic Specialists of Louisiana. My specialty includes total joint reconstruction and sports medicine. I was born and raised in Shreveport, Louisiana. I went to Captain Shreve, which I'm very proud of, and I met my wife in Waco, Texas when I went to Baylor. So I always wanted to be a doctor ever since I was little. Even in career day in elementary school, I would always wear scrubs and pretend like I was a doctor. So it's something that I've wanted to do my whole life. I don't really know why. Initially, my mom was a nurse at Willis-Knighton for 30 years, and so that was my initial exposure to it. And then I had one injury after another growing up, and so I spent a lot of time going to orthopedic specialists as a patient, and so it was just something that I always wanted to do, and so I just put the steps together in order to make it happen. As part of my residency, I went to the University of Oklahoma, which is very, very near and dear to my heart. That was a very, very sweet time in my life, and we were exposed to all the different disciplines in orthopedic surgery, and so really initially I thought about being a tumor doctor, but I didn't want to live in a huge metropolitan area. You have to live in like a Dallas or a Houston, and so then I had an affinity for sports just because of the injuries that I had in the past, and then I also love total joint reconstruction just because I feel like I communicate well with the aging population, and I think I feel like I have kind of a gift of explaining what they're up against and kind of alleviating some of those fears. And so when it came time to choose a subspecialty, I chose a combination of sports medicine and total joint reconstruction. So I actually did extended training, or what we call in our line of work, fellowships in both. Most sports-related activities do not occur in young, athletic high schoolers that are running around participating in sports. Most of them are really healthy and they don't get hurt. So most of sports-related injuries are middle-aged people like myself who think they're in high school and spend a lot of time playing sports and not enough time stretching and getting ready to play sports. And so we see everything from certainly, the shoulder dislocations and ACL reconstructions that you see in young people, but a lot of what we see is arthritic changes that are preventing the aging population from continuing to participate. I think the biggest thing in taking care of patients in our community is, number one, it helps a ton being from here. So you understand what their reference points are, why they think the things they do, why they don't think the things they don't, and truly they all walk into the doctor's office a little bit scared that you're going to tell them that they need surgery. And so I think the biggest thing is just communicating and knowing that 98 or 99% of the people that come here don't need surgery. And so there's lots of other alternatives. And really in the setting that we practice in, you don't ever have to have surgery. I mean, I say 100 times a week, if your bones are sticking out of your skin, I'm happy for your thoughts, but you have to have surgery. Otherwise, the rest of this is elective. And so it becomes a question of how afraid are you of having a procedure versus how afraid are you of living without a procedure?